Hello and welcome to Inside View. I'm your host, Joel Metzger, and joining me today is Damon Doss, and he is the Executive Director for the Mark Twain Healthcare District, which is in Calaveras County. Damon, welcome.
Thank you very much, Joel.
Really nice to have you on the show for the first time.
My pleasure. Pleasure to be here.
And I want the viewers to know that we're going to be having you and others from the Healthcare District Board back over the next few months and years to keep the public informed about what's going on. And that's in lieu of you guys even doing your own show. So we're really excited to have you back a few times.
Thank you. Thank you.
Before we get into what your position is, as well as what the district does, I want our viewers to get to know you a little bit. So let's start with where you were born and how you made it to California.
Sure. Yes, I was born in Chickasha, Oklahoma, and I really love Oklahoma. It's a wonderful place to be from, actually. Moved out here when I was 12 years old in 1959. In '59, there was a tremendous boom of education and growth in the educational system. And so a lot of teachers, and my mother and father were both school teachers, a lot of teachers were recruited from Kansas, Oklahoma, Texas, Nebraska to come to California and be school teachers. And so my parents came to Santa Rosa, California, which is in Sonoma County. And that's where I live today, actually, in Sonoma County. I've lived there ever since.
Throughout your time in Sonoma, what was your educational pursuits as you moved into your current career?
I went through junior high and high school, and then Santa Rosa Junior College, and then I was on my way, or hoping I was going to go on to San Jose State, but I kind of liked staying around home, and so I went to Sonoma State. Sonoma State was a brand new university then, and only had 5 buildings, and very small and no grounds to speak of. It's a beautiful campus today. But went to Sonoma State, and then when I finished at Sonoma State, got working in healthcare, looking for a way to provide an income because I was going to go to McGeorge Law School. I thought I wanted to be an attorney. So I was looking for a way to pay my way through law school, and I became a respiratory therapist. And I just liked healthcare. And so from respiratory care, worked into a middle management position in respiratory care, and then I decided to become an RN. So I went to nursing school at Santa Rosa Junior College, and that was now I'm completely into healthcare. On the clinical side, spent several years on the clinical side, and then as things would have it, pretty soon you're kind of doing some supervisor management. Pretty soon you're in charge of maybe 1 or 2 departments of a clinical area. And so I just kept moving up into that area, and eventually became Chief Operating Officer of the Petaluma Valley Hospital, which is a 100-bed hospital in Petaluma.
And as compared to Mark Twain Medical Center, how many beds do we have here?
Well, you are a critical access hospital, so you are limited to 25 beds that you could have maximum beds. But I think you actually have about 40 some odd beds, but you're a critical access hospital, so 25 is what you can have.
So that was a lot bigger down in Petaluma.
It is, but Petaluma is much smaller today. All hospitals are much smaller today. Very few hospitals. There's a few hospitals in major cities, certainly UCSF and some of the city hospitals stay full and at capacity. Many hospitals run 50 to 60% of their licensure capacity. So all hospitals are much smaller. In Petaluma today, even though they have 56,000 people and they serve a service area of 100,000, which is twice as big as Calaveras County, it's not uncommon for them to only have 25 or 30 patients.
Wow.
And so I've seen 18, 20, 24 patients at at Mark Twain Medical Center. So you can get pretty busy here too.
Now, Damon, you have kind of a unique position now where you are kind of a specialist and you've been going out to help various hospitals out. Can you explain for our viewers a little bit about what you do?
Sure. I retired from hospital administration and direct administration in April of 2011, but I always wanted to do interim work. And so I started doing interim work for different healthcare districts, and I've kind of developed this niche, if you would, of working with smaller healthcare districts. Many of them are community-based healthcare districts. Some of them have had recent history of issues with grand juries and or LAFCO and or other agencies, and so that's kind of the area that I've developed some, if you want to call it a specialty, that might be my area, yeah.
And Calaveras meets some of the criteria you just mentioned. There was a grand jury report that looked into the healthcare district, and that kind of raised some concerns. And I think, were you brought in after or before?
Yes,
Okay.
after. My first meeting with the Mark Twain Healthcare District was in July of 2012, and we did a strategic planning, a 2-day strategic planning session. And from that, came an offer for them to be with them on a more regular basis starting in August of 2012. And I work with them about 16 to 20 hours a week. So it's slightly less than part-time.
And you drive up from your home, which is still in Sonoma County?
Yes, I come up usually Monday night or Tuesday morning and spend a couple of days here in Calaveras. I love it up here. And occasionally, my wife comes with me and we extend it. Sometimes I'll stay from Tuesday, Wednesday, Thursday, and just stay here till the next Tuesday, Wednesday, Thursday, depending upon the events and how things are going.
What are some things that you've enjoyed about this particular area?
Well, you know, actually, I live on Highway 12. And Highway 12 dead ends here in San Andreas, or begins, you might say, but it says end as coming from my direction. So I get on Highway 12 in a little village called Kenwood, which is a wine country village. We have 5 wineries in Kenwood. So I get on Highway 12, turn right, and just follow myself all the way to San Andreas. San Andreas is a lot like Sonoma and Napa County with a great deal more elevation changes until you get up to around Murphy's, and then you start getting into a wholly different kind of area. But there are parts of western Sonoma County out by the coast that looks a lot like Murphy's also.
Definitely 2 beautiful areas.
Oh man, absolutely, absolutely. And I've really enjoyed the wineries up here. They're first-rate wineries.
I have to agree with you there.
Yeah, yeah.
So Damon, it seems as though, to give people some context, there was a little bit of a crisis at the hospital in general in terms of community relations, not just with the Healthcare District Board, but also with the hospital in general. Within the last year, some of that has transpired. And I personally have seen some changes, and I think that they've been mostly positive. But could you kind of go over where the hospital was, where it is, and where it hopes to be?
Yeah, some of the part of where it was, I'm just going by, quite frankly, a lot of press stories, reading the grand jury report, and looking at a lot of the history of the healthcare district and its relationships. But it did appear that there was some conflict between administration, which is a contracted management service agreement with Dignity Health, and the administrator of it was Catholic Healthcare West, and administration and various members of the medical staff, and perhaps even some members of the Mark Twain Healthcare District Board. I couldn't speak to the relationships on the Mark Twain Medical or St. Joseph Hospital Corporate Board because I wasn't there at those meetings, but I'm just reading from what I've read. There were conflicts in regards to direction, and I think what happened is that there was an element of lack of trust that developed, perhaps on all 3 sides, meaning the Healthcare District Board, the corporate board that actually governs the hospital, and the management service agreement or the management contract with what was in Catholic Healthcare West. So it seems like there was a breakdown, but I can tell you this, in my time there, when I came, I didn't experience any of that. Craig Marks, who is the CEO of Mark Twain Medical Center, was already in place and was clearly moving into a change of attitude and of how he relates to both the community and to the employees and the medical staff. So I never experienced any of that myself. It's all historical for me. I've seen nothing but really positive growth in trying to address the issues. And I would say, from my perspective, there is really a difference in how physicians and the administration seem to be working together now as compared to what I've read about the past.
Let's give the public an idea of what the healthcare board actually is, because not everyone really knows.
Sure.
You are kind of the executive director at this point. You're kind of leading them, but there are several other board members. So first, who is on the board?
Sure. Well, let's just go through the officers, and that way I can not forget anybody. Lynn Reed, who is a practicing occupational therapist, is our board chairman and president. And she's been president now for 2 terms, and I think she's in her 2nd term as an elected official. We have as our treasurer Ken McInturf. Ken has been he's well known in this community as an attorney, as a banker, and so perfect role for a treasurer, and he's a very good treasurer. Our current board secretary is Dr. Peter Oliver, a surgeon here in this community. And then we have 2 members at large. Our veteran, Bob Campana, who's been on the board for over 30 years. And I'm sure we're going to be speaking about Bob's role a little later.
We will.
And then we have a brand new member, and that's Dr. Randy Smart. And now that's an interesting story because he is a continuation. His mother, Colleen Smart, had served on the Mark Twain Healthcare District Board for 30 years also. So when she retired and chose not to run again in the 2012 elections, Dr. Smart, who practices in Murphy's, ran and won handily. And so now he's on the board, continuing the Smart family tradition of serving on the board.
When was this board roughly formed?
Sure, 1946. There was a vote of the people in August 27th of 1946. Can't believe I remember that. Anyway, in August 27th, 1946. And it was what happened really, this is happening all across the state. If you look at when the healthcare districts throughout the state started, almost all of them started in the mid to late 40s. And really what happened is a lot of the rural communities, people had been away from their community because of the war. They had seen what other communities had, and they had seen the level of medical care in other communities. And they wanted it in their own home. And so there were several laws passed, the Hill-Burton Act is one of them, that allowed healthcare districts. We are a public agency. We are a special district. We are governed by LAFCO. Every county has a LAFCO, and we're part of the LAFCO process here in Calaveras County. So we're a special district. But healthcare districts are kind of a hybrid within special districts. But all of a sudden, there were 70 plus healthcare districts around the state of California. And most of them started in 45, 46, and 47.
So it was formed, and the district's mission then versus now, is it pretty much the same thing?
Well, it was, except really I think their real mission was, how do we retain some doctors, get new doctors, but build a hospital? So they started looking at how do they get access to some of these Hill-Burton dollars. And in 1951, the original Mark Twain Hospital was opened in 1951. And there's some great records and pictures that they have on file up at the hospital of that event. And I think even Governor Earl Warren came to the one of the openings. But that was in 1951. So it took them about 5 years from the time they were organized to go through all the legal hoops, to get the money, to get it built, and to open the hospital.
Before we get to kind of a shakeup, I think it was in the early 80s or late 80s when there was a change in terms of the district's relationship with...
Late 80s, yes.
But before that, there is a taxpayer role in the district in
Yes.
terms of funding. How does that work?
Well, it's a property tax, and there's a certain percentage of that property tax that goes into a whole host of healthcare districts, a whole host of special districts. There will be water districts, there are school districts, and there's healthcare districts within that property tax. Currently, we're receiving about $845,000 a year. When property values were slightly higher, they were over $1 million. This year, we got notice from the auditors that it's going to be about $845, $847 is the amount that we'll receive in our property tax. And that's based upon a certain percentage that's allocated to all of us. And so there's actually a report that comes out annually that lists every one of the districts and how much they receive. And it could be, districts, like I say, it could be water districts, it could be fire districts, school districts, and healthcare districts.
And we'll talk about where that money goes a little bit later on.
Sure.
Now, in the late 80s, there was a shakeup in terms of the hospital wasn't doing very well.
Exactly.
And you mentioned Robert Campana earlier. He was instrumental in finding a solution to that. So what happened there?
Yeah, exactly right. In the late 80s, there was a tremendous difficulty in a lot of districts finding a way to keep themselves funded. Utilization was falling. The costs were going up because they were having to compete for medical personnel with larger facilities. It wasn't that difficult to drive to Stockton or Lodi and be a nurse. So you had to compete to keep the nurses, and that means your costs go up. And yet reimbursements were not going up. I've heard stories from Bob and others about those days, and they struggle sometimes to even make payroll. So they began conversations. First of all, they actually had an alignment for 1 year with Sutter, which I didn't even know about. Didn't know that existed until I came here. That wasn't satisfactory at that time. And so they began to have conversations with St. Joseph Hospitals in Stockton. And Bob was one of the key persons. There are 5 members on the board, so I'm sure the others, I know Colleen was also a part of that process. Colleen Smart, I just don't know the others, unfortunately. They began to have this conversation with St. Joseph of Stockton. And really, that was the beginnings of that whole concept of a public hospital, a public agency, leasing itself, leasing operations, retaining the ownership of the building and grounds, but leasing operations. And when you lease operations in a hospital, you actually lease the license with the state of California. So you have a transfer of license from the district to the new entity. Now here's what's incredible is how you built the new entity. There was no pathway. There wasn't like, oh yeah, so-and-so did that before. Oh yeah, so-and-so. There was no pathway. And so this district was one of the very first to actually do this process, and I would say one of the most successful and unique.
Now, exactly how the relationships work between the district, the corporate board, and Dignity Health, which was formerly CHW, is a little bit complicated.
Sure.
But if we can try to explain it in a somewhat simple way, how do these 3 entities work together?
You know, that it is complicated, but it's very explainable, I think. So we'll work on that. The Mark Twain Healthcare District was the authority, the taxing authority, the public agency that created the district and built the hospital. They then partnered with and chose a 501c3 to lease the hospital operations to. Now, what was unique is this is a community-based 501c3. For the folks who don't know, a 501c3 is a nonprofit. So they created a nonprofit board. And in that creation, they created the process of how you transfer the authority from the Mark Twain Healthcare District to the nonprofit board. And that was the very unique piece that everybody wanted to see. How could that be done? And so what happens is that the Mark Twain Healthcare District Board actually has 2 of its members. Remember, we have 5. So 2 of our 5, less than a majority, but 2 of our 5 automatically sit on this nonprofit board. Currently, those are Mr. Robert Campana and Ken McInturf. And those 2 gentlemen sit on the Mark Twain Medical Center corporate board. In addition, the Healthcare District Board gets to place a nominee, nominate an additional member, community member. So there's 3 members right there. And so then in addition to that, there are 2 physicians currently on the Mark Twain Medical Center corporate board, and then 3 representatives from Dignity Health. So a total of 8 members are on that board. So the district board, while we are the landlord, and we clearly are a landlord, but we're much more than a landlord also because we're integrated into the operations by having 2 of our members are actually on the board, plus 1 of our nominees is on the board. So 3 of the 8 are actually there because of the Healthcare District Board. So it's a unique concept, and it has been duplicated multiple times around the state using the very model that started right here in Calaveras.
Very cool.
Yeah.
And the corporate board, which leases the use of the buildings and grounds from the district, then is responsible to operate the hospital?
Absolutely. When you look at the license, the state of California doesn't say this hospital is licensed to Dignity Health. It's licensed to the Mark Twain Medical Center Corporate Board. The Medical Center Corporate Board then has a management services agreement with Dignity Health. And Dignity Health is well represented, I would say excellently represented by Craig Marks as the CEO and Jacob Lewis, who is the CFO. In the organization, or in those folks who actually run the hospital day to day, management and line people, whether it be a respiratory therapist, a nurse, materials manager, someone in the engineering department, all of those employees are actually employees of the Mark Twain Medical Center Corporate Board. That's who they work for. Mr. Marks and Mr. Lewis work for Dignity Health.
Okay, so that is kind of how the relationship works with those three different entities.
Yeah.
And hopefully people understand that a little bit better now at this point. But if they do want to find out more, and we'll do this at the end as well, they can go to your website, and if you'll just say what that is.
MarkTwainHealthDistrict.org. And we really, it's a brand new website that we never had a website before, and it's been up about 4 months. Most of it's now up. There's a few areas still in construction, but there's a really good story about how we came to be, how we align ourselves, and I think we see ourselves, I know we see ourselves, as true partners with the Mark Twain Medical Center Corporate Board and the representatives from Dignity Health. We combined are stronger than we would be by ourselves if the Mark Twain Healthcare District had sole responsibility of the hospital. Even though we have a taxing authority, we wouldn't have necessarily the resources available to us that we have through the partnership that flows through the corporate board and works with Dignity Health. It's a tremendous advantage.
Let's talk a little bit about what the board does. We talked about some money, $840,000 roughly, that comes in from the taxpayers, and there may be other revenue sources as well. What does the board spend money on, and what is the mission of the board?
Sure. Well, the mission is a collaboration with our partners and other community entities, as well as individuals, to improve the health care of everybody in Calaveras County. Well, that's another interesting thing about this healthcare district. Most healthcare districts serve a geographical area tied to the community they're in. This is not the San Andreas Healthcare District. This is the Calaveras Healthcare District. It covers the whole county. So that changes those relationships. In Petaluma, where I spent a good deal of time, it was the Petaluma Healthcare District, and it served Petaluma and areas nearby, but it really serves southern Sonoma County. We serve the whole county here, all of those areas, and so we have a different relationship, and so our mission is to work with everybody in the county, whether it be in West Point, which I have not been to yet, but I'm going to get there, to West Point, to Copperopolis, to Arnold.
And as part of that mission, you are working on a lot of different projects. And I actually attended a meeting this morning and heard some really great things. One of the things I wanted the community to know about is the desire to purchase land on which a new health center might be built. I know the district often does purchase land on which a building can be built. Where is this new center potentially going to go?
Can I answer that by answering one other thing first?
You bet.
We do indeed. This is not something new for the district. If you look at the grounds near the hospital where there's a whole series of medical office buildings here in San Andreas, those were purchased by the district in the land, and we have leased back to either developers or physicians or different people. But so it's not uncommon for us to be the facilitator, convener, making things happen for medical office space. in Angels Camp, several years ago, the district purchased a piece of property that off of Stanislaus Street in Angels Camp. And the concept was that we would put a women's health center there. But our needs have grown beyond that area, and the development cost of that particular piece of property are going to be significant. So we've been looking at another piece of property that might be better for us and better for the community. The district, I can't go into the details of the terms, but certainly we've made public, the last two public meetings, that we are looking at a property at the corner of 49 and 4, highways 49 and 4 off the Dogtown Road. And there's about 3 acres in that area that we're looking at as a potential site. And so today, part of the process today was to bring the board up to date on my conversations with the owners and to just tell them where we are in the process. And I would anticipate that in April, next month's board meeting, we'll have quite a bit of development in regards to that potential project. It's important for us to have a modern, efficient facility in Angels Camp with a good high profile. It's efficient. It's important to have the space to have the diagnostics that we need, both lab, radiology, and others, and space for specialists as well as primary care. As one of the reports you saw today, and it was us talking about primary care and how the ratio of primary care physicians to each individual person is not very good in Calaveras County as compared to neighboring counties and across California. So one of the things that we need to do is to increase our number of primary care physicians. This would be an excellent location for that.
And I know that the district board has been very, very in support of encouraging whatever the hospital is doing in order to recruit quality primary care physicians. And I think that that's already begun to swing toward an increase. In the last couple minutes that we have, if there's one thing that you would want a viewer who'd never heard of the district to take away from this interview, what would that be? The Mark Twain Healthcare District Board represents the people of Calaveras. We are their direct connect to the Mark Twain Medical Center. There is a way for them to influence what they think should be there, what's going on in that regards, what's happening in community health. Not only are we there to work with Mark Twain Medical Center and with Dignity Health, we're there to expand and look at community health as a whole. So we are an access point for every person in Calaveras if they have a question about what they consider a gap in services, whether that be in mental health or physical health, either one of those. It would be in prevention. We can be involved in a lot of things. We can actually participate in many programs. Our charter, if you would, allows us to do that. If people want to contact you with questions or find out more, what's the website one more time? MarkTwainHealthDistrict.org. And if they wanted to email you? DDoS@MarkTwainHealthDistrict.org. Damon, thanks for joining me. Thank you. Appreciate it. And thank you for joining me on this edition of Inside View. I'm your host, Joel Metzger, and I hope to see you next time.